I'm told I don't really need a loudspeaker with a voice like a foghorn. Can you hear me okay? My name's Ian Gilmore and I chair the Alcohol Health Alliance, and a very warm welcome to everyone here, particularly the parliamentarians, particularly to our host today, Dan Carden, MP from Liverpool, and to all our stakeholders, members of the AHA and so on. We have over 60 members now, and this is our 16th year, so we're beginning to feel our age, passing out of the teenage years soon. I have two important duties this morning. The first is to introduce a report that we're publishing today on what is it on? I know perfectly what it's on. The report that confirms what we already knew, that the public are behind us. It's very easy to be persuaded by governments that such and such will be a vote loser and so on, but we know from previous work that the public is behind us, and that's been confirmed by this latest report that we've done in partnership with YouGov, and it shows that they do want action. They do want children protected. They do want advertising not to be in their face 24/7, and we've now got extra proof that that is the case. And I think this is really important, I think, in our dialogue with parliamentarians who have tended to be anxious about taking a stand about what people sometimes portray as our favourite drug. So this is a really important report, and I commend it to you. The second thing we're doing today is producing our manifesto to persuade politicians of all parties what they should be doing regarding alcohol, looking for evidence-based policies that really will make a difference. We've highlighted four particular areas in here, and I think they actually cover the whole agenda. One is protecting children and supporting those who are already suffering harm from alcohol. That's the number one, and that's absolutely vital. And as a clinician, I know how woefully inadequate treatment services are currently for people with alcohol dependence. Secondly, we want to empower both individuals and communities to help themselves in this area. And I think part of this, of course, is health inequalities, and we know that alcohol harm has huge differences across the social spectrum, and that we need to empower communities so they can tackle that. We need to strengthen NHS services. As I said earlier, treatment services are particularly woeful. In some parts of the country, only one dependent patient in 10 will have access to treatment services. An absolute scandal in the 21st century. And the fourth is to preserve the public purse. This is to draw attention to the fact that alcohol is costing us money. All right, the Treasury sees some money coming in, but an awful lot more money goes out of the coffers of the Treasury from the harm from alcohol. One statistic that absolutely shocked me recently, and I take quite a lot of shocking, was the fact that 40% of ambulance time is taken up with alcohol-related problems. 40%. I found that very hard to believe. I'd like to thank the AHA staff that have been involved in developing these two pieces of work. They're marvellous, and we're really, really grateful to them. We've got three speakers to enlarge on some of the things I've said, and a particular delight first to ask our host, Dan Carden, MP, who's made such a huge difference to the alcohol scene in his time as an MP. Dan.